Hi, my name is Raven Peterson. I'm currently doing clinicals at Adams County Health Center. It's a federally qualified health clinic in a rural part of Idaho. It's family practice and urgent care, so we see a good mix of patients there. The case I'm going to be discussing today is on an adolescent female, chief complaint of enlarged lymph nodes. She came in to the clinic initially with lymph nodes on the left side of her neck 3 weeks prior to the visit I am doing my soap node on. Since her initial visit, they've spread to the other side of her neck, and she's also lost a significant amount of weight over the past 7 months. We referred her to a CT and ultrasound. Ultrasound was inconclusive, and the CT indicated no abnormalities. But she's back today with reports of new enlarged lymph nodes in her groin and just overall not feeling that well. So that's brief HPI. This was a really meaningful, memorable, and interesting and challenging case for me. Meaningful because I felt like I definitely developed a relationship and bonded with the patient and her family. It was memorable because it was interesting, because it was challenging, and it was interesting because it was dealing with something I've not dealt with directly as a provider, and it was challenging for that same reason. So the presentation, her ID, date of birth, 10/9/2006, 14-year-old female. She was accompanied by her mom in all the visits, coming in for enlarged lymph nodes. So she was first seen 3 weeks prior to this appointment with swollen lymph nodes on her left side. They have since spread to the right side of her neck and the posterior cervical chain. Lymph nodes are moderately fixed and firm and range between 4 to 8 millimeters in size. They are scattered in formation. She reports pain with palpation. She has had a 20-pound weight loss in the past 6 to 7 months. Lab work showed elevated lymphocyte percentage at 50.4% on her initial lab workup. Her lymphocyte count was normal. Ultrasound was ordered on her initial appointment. The results were inconclusive and recommended a neck CT. CT results indicated that there were no signs of lymphadenopathy and lymph nodes appeared normal. At today's appointment, she's also complaining of the lymph nodes in her groin. She has no recent colds, fevers, or any signs or symptoms of infection, and she complains of fatigue and irritability. Past medical history, the only problem she has is mild intermittent asthma. She has an albuterol inhaler that she rarely has to use, mostly with exercise. Surgeries and hospitalizations, no recent surgeries and no recent hospitalizations. No known drug allergies, no known allergies. The only medication she's on is albuterol, like I said, and then she has a Nexplanon contraceptive device in her arm that was placed on 9/15/2020. Diet, exercise, and caffeine. She reports a poor appetite and loss of appetite. She snacks throughout the day and rarely eats a full meal. The food that she eats is poor in quality. Her family history is relatively insignificant for what we're worried about. Her mother is healthy, father has hypertension, brother is healthy, sister has asthma and childhood obesity. Maternal grandmother had a suspicious breast tumor removed at 50. Maternal grandfather unknown. Paternal grandfather paternal grandmother hypertension, type 2 diabetes, and obesity. Then paternal grandfather deceased at 65 from an MI. So her social history: alcohol, tobacco. She's never a smoker, denies use of alcohol and recreational drugs. Her review of systems: the only thing positive was her weight loss, decreased activity, fatigue, irritability, and then anxiety and depression related to her health. But cardiorespiratory, GI, GU, and neuro were all normal, or she didn't report any problems. So for her vital signs, she's 63 inches tall, 89 pounds today. So her BMI is 15.77, blood pressure 110/72, pulse is 80, respiration 12, and temp 97.3. For the physical exam, constitutional. Again, she lost that 20 pounds in the past 7 months. Other than that, no acute distress. She does appear pale. Cardiovascular, respiratory, HENT, vascular, abdomen assessments all were within normal limits. Her skin, again, it appeared pale. Her neck or lymphatic inspection, she has those enlarged lymph nodes located in bilateral posterior cervical chains in a scattered formation. They are firm, moderately fixed, and range between 4 to 8 millimeters in size. She reports pain with the palpation. She also reported the inguinal lymph nodes coming into the appointment today, but me or my preceptor, we did not note them on our physical exam. So, yeah, with our... I discussed the recent diagnostics in my HPI and discussing she had a CBC, CMP, thyroid check, and the only abnormal lab was her elevated lymphocyte percentage, that initial workup, but on repeat labs, all of her lab work came back normal, and then we discussed the ultrasound and CT results as well. So for the assessment and plan, the current diagnosis we have for her is enlarged lymph nodes, and we are keeping it at that because we don't have evidence to suggest anything else. Other considerations we are thinking are a lymphoma or leukemia. But at this point, sticking with enlarged lymph nodes because, again, we just don't have enough evidence to suggest otherwise. So, her labs were within normal limits. Ultrasounds were inconclusive, and next CT indicated normal findings. So the plan from here, because she has had that 20-pound weight loss and we are not comfortable with it, we are referring her to a ENT oncologist so he can take a closer look and just make sure that they didn't miss anything or there isn't something else going on with her. So for lymphoma, she had the weight loss. She has a pale appearance. She reports fatigue and irritability. And her lymph nodes are somewhat suspicious. And then for leukemia, the weight loss, pale appearance, fatigue, irritability, the lymph nodes, the elevated lymphocyte percentage on that initial lab work. But she has no petechia, no fever or chills, no infection or severe illness, no abnormal bruising or bleeding. So yeah, as far as the lymph nodes, enlarged lymph nodes go, from here the plan is to just refer her to the specialist to get another set of eyes on this case. And then another thing we're considering with her is her anxiety, depression. She came in and reported anxiety related to her health and mild depression, and she has poor appetite, she has weight loss, she appears pale, she's lethargic and irritable. So for her plan, we said if she continues struggling with her anxiety, we would like her to consider counseling. We made the referral that day and just advised her to consider it, and if she thinks it's something she wants to do, just call them and they can make an appointment whenever. So yes, to finish off the holistic approach and caring science part of the assignment, how I collaborated with the family and other people on the who were involved with the case on the medical team. So with the family, I kept close communication between appointments and just kept them updated on the diagnostic results. Called them to let them know when we got the results and when they should come in and whatnot. And then we also, to incorporate or collaborate with other members of the care team, we discussed the case with the medical director and MD at the clinic, and just making sure we weren't missing anything, making any mistakes or not considering something. So which of Jean Watson's caring processes were considered with this patient? Going over the 10 processes of hers, I would almost say that we used almost every one of them, but for sure the primary process we incorporated was trust, and just making sure we established a good relationship with the patient and family so they were comfortable with our guidance in this, and that they knew that we were doing everything we can to help them and make sure that we're doing the best job on their care. And in what ways was your care of this patient representative of a holistic approach? After she had several of the diagnostic studies complete without definitive results, it was obvious that the mother and patient were getting very anxious and worried about what was going on. And so that's when we incorporated the psychological aspect of care into her care plan as well, and just talking about the anxiety and mild depression that she reported. And so that really brought it full circle and made this holistic, interesting, challenging case for me that I really enjoyed and I will most likely remember for a long time. So thank you for listening.